Family Therapy Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I ask members of the advisory committee to respond to a roll call to signify their presence in this open meeting that's being conducted remotely through conference call or electronic medium. Jim Kilmartin.
Present.
Jardine Coleman. Nicole Eitzen.
Present.
John Sleeker.
Present.
James Godby. I see his picture, or I see his box there, so I think he's present. Chris Haben.
Present.
Marcy Lechtenberg.
Present.
Heidi Vella.
Present.
I note the following BSRB staff members are also present: David Fye and Leslie Allen.
Here.
Next, David Fye will read a message about this meeting being held remotely.
Thank you, Mary. This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the Executive Director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting as no individuals requested to provide public comment. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by a medium of interactive communication that allows members of the public without cost to attend the meetings using the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of KOMA are not suspended. As such, we will be conducting this meeting pursuant to the KOMA. On April 23rd, 2024, we sent notice of the advisory committee meeting to all individuals who had requested notice of such meeting. The notice is also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the agenda on that website. An agenda and other media materials have been posted on the website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. The recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And I did check the conference call line before we got started. There's no one currently on the conference call line, but I'll let you know if I hear someone click into the meeting that way. And during the introductory information for the meeting, I saw that Jardine Coleman has entered the meeting, so she is present as well.
Great. Thank you so much, David, and welcome, Jardine. First item of business for us is approval of the agenda. If there aren't any changes or additions, I'll take a motion to approve the agenda.
So moved.
Thank you, Chris.
Second.
I'm sorry, was that Jim? All in favor, say aye.
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 Any opposed, same sign. Thank you. The next item of business is review the minutes from the previous meeting on April 12th. I'll take a motion to approve as soon as someone's ready for that. There aren't any changes or additions.
I move to approve.
Second.
All those in favor, please say aye.
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 Any opposed, same sign. Great, thank you so much. Dave, I'll hand it over to you for the Executive Director's report.
Great, thank you, Mary. We'll start with some operations updates. I wanted to let individuals know about two major updates. First, the BSRB website has changed. If you have not been to the website in the last couple of months, it's going to look quite a bit different the next time that you visit the website. We have switched over to a new platform under Granicus, so it will look a little bit different, but a lot of the same functionality is still on the website. But we have tried to do some improvements to help with the functionality. There are some buttons now you'll see at the top of the website, and it should allow people to navigate to some of the information they want to get to a little bit easier. Also, if you're accessing the website on a mobile device, it should look a lot cleaner and should help people out in terms of getting to the information. Now, if you're used to going to our website and seeing all the information on the front page, you will need to click some separate links to get some of that information, but it all should be there If you are on the website and you see any issues, please let us know. We're trying to work through any of the last remaining little issues, but we've had a pretty smooth transition overall and really happy to be working with Granicus on the new website. Another operations update I wanted to make you aware of, we have completed an agreement to work with a company called CE Broker, and we've mentioned CE Broker a few times this spring. CE Broker is a private company that works with state licensing boards like the BSRB. They have already partnered with the Board of Healing Arts and Board of Nursing in Kansas, and they work with a number of different other states as well. But the services that they offer, the partnership with the agencies is sort of a free agreement. And then what they offer is for licensees to be able to set up a free account with them. And then they can upload their documentation that demonstrates they completed their continuing education. So BSRB right now, when someone renews their license, we audit 10% of all of those individuals renewing their license. And part of the audit process is they have to demonstrate completion of their CE hours. So right now we would request the information from those individuals. They would have to get it to the office and there would be some back and forth. With the e-broker, essentially what individuals would have the ability to do is upload that documentation in advance, assign it to different categories such as ethics, or if they are required to do diagnosis and treatment in a certain number of hours, they can plug it into those categories. And then if they are selected for audit, what the BSRB could do is log into the CE broker portal, verify that continuing education, and then complete the audit process a lot more quickly and a lot more smoothly. And for applicants or licensees, it's a nice benefit that you don't have to hold on to the paper copies of a lot of that information for a couple of years, not knowing if you'll be selected for audit when you renew. So it's a nice service. It is an optional service for licensees, but since we have completed the agreement, we'll be rolling that out sometime in the next few months. The e-broker has been working with us to kind of get an idea of how many licensees we have in each of the professions we regulate. And based on those numbers, they decided that they would start with one profession and then move on to the other professions in order. And so the first one they're going to start with is professional counseling. So that'll be the first one they're going to be working with. And then I think social work after that, and then moving on to the other professions in that order. So I'll be on the lookout for that, but we will send some messages out to licensees as we get closer to rolling that out, that individuals can start signing up for those free accounts. In terms of some other updates, I'll move to some legislative updates. There's two bills I wanted to make sure that you are aware of that passed for the BSRB this year. One of those is the Social Work Multi-State Compact, that is House Bill 2484. The BSRB was one of the main proponents of that compact. And so we are happy that that bill has passed. It was signed into law by the governor. The compact language was finalized last spring, pretty late into the legislative session, so only one state was able to pass it last year. This year, the model language stated that 7 states had to pass it for the Rules Committee and the Compact Commission to start meeting to work on the operating rules. So Kansas was the 7th state to pass the compact. And so with that being completed, we will be able to identify a compact commissioner this summer, and then this fall, the compact commission will be able to start meeting, like I said, and work out some of the operating rules of the compact. There's a number of different items to be resolved, not just the operating rules, but also working on the data system and a way to make sure the public is aware of who has the ability to practice under this new compact and different things like that. So based on the time frame for other compacts, I think it's likely that this will not go live until maybe sometime in the fall of next year. Hopefully it will be sooner, but realistically, based on what I've seen, I think that's probably a realistic goal. But really happy that that compact passed, and looking forward to helping people receive more information on that. And there is information posted on our website. You can kind of look at the information about the compact on the website as well. Another bill I wanted to make you aware of that does affect the BSRB is House Bill 2745. That was a bill that would will exempt military spouses of active duty military service members from occupational licensing fees. And so this is not unique to the BSRB. This is basically for any regulatory bodies in the state. But essentially, if there is a military spouse of an active duty service member, they no longer have to pay the licensing agency things like application fees or original license fees or license renewal fees. So we've been working with our license host to make sure that that is implemented. The implementation date for that is July 1st. So what we'll probably do is we'll probably have something built into the system if someone identifies themselves as an active duty service member and supplies any necessary documentation to demonstrate that, they'll essentially get a waiver from the fees to pay to renew their license. Same thing with people applying for licensure. If they can demonstrate they are an active duty service member or spouse, they get a waiver from those fees as well. So should benefit some of those individuals. There is, an effect on the BSRB, and that is some of our license revenue that we use to balance our operations. And so we will be receiving less license revenue from that. And right now we have tracked our new applicants to our military members and military spouses for the last few years. But in terms of individuals who've been licensed for a little while, that number is not completely known. We have an estimate for that, but in terms of knowing the full impact of losing that revenue on an ongoing basis, we'll have to kind of gauge that over the next few years as we collect data on that information. But I want to make you aware of those two bills. Moving next to items from the last board meeting. I do try to keep the advisory committees aware of significant actions that happened at the last board meeting. And just a reminder too, all of the board meetings are streamed on the BSRB YouTube channel. So any advisory committee members are welcome to watch those meetings or review the information that's posted on the website. But I'll just highlight a few items from that meeting that took place on May 13th. First, we've had a number of regulations that have been going through the process to become official. And the board did take a roll call vote to formally adopt 11 proposed changes to regulations for the profession. A lot of those had to do with educational requirements for licensure. The majority of those regulations dealt with the addiction counseling profession, but there were also several other professions that maybe had one or two regulations. Some of that information goes back to the flexibility the board added to the definition of the term in residence for some of the individuals who attended non-accredited schools. There's also some changes to basically recognize the national accrediting body for the addiction counseling profession, and then increase some other flexibility as it relates to coursework from some of the professions as well. So there was some concern by a legislative committee that reviewed those regulations concerning the use of the term synchronous as it relates to the in-residence definition. Our definition basically in the past or currently says that individuals in certain cases would have to get some of their coursework physically at the school, and that's how we had defined the term in residence. The new definition will open that up and allow it to be met either by physically being at the school or by synchronous video conferencing. And so that committee requested some language to clarify the meaning of that word. And what we mean by synchronous is we really mean real time. And so just kind of some common sense language we added to the definition to clarify that for anyone who was wondering about that term. And then also there was some language that was newly added to the addiction counseling educational requirements for licensure. There was one instance of the term substance use, and the committee had recommended replacing that term with the term biopsychosocial. And the committee was unfamiliar with that term and requested some clarification. So the board just clarified that in the context of that language, biopsychosocial really means the biological, psychological, and social well-being of the person. And so that additional language was put in there, and we really do try to be responsive to those comments that the legislative committees make. So with those proposed changes, the board did formally adopt those regulations. They were published in the Kansas Register on June 6th, and so they will become effective here in about one more week on June 21st. And when they become effective, there's a handful of individuals will be able to approve to be able to take the licensing examination or be able to approve for them to become licensed. So we're happy to be able to move those individuals forward in the licensure process. Another item I wanted to make you aware of at the board meeting, the board did formally reappoint several advisory committee members. So for the Marriage and Family Therapy Advisory Committee, Nicole Eisen, Chris Haben, and Marcy Lechtenberg were reappointed to serve another 2-year term. As a reminder, advisory committee members serve 2-year terms and can be reappointed to serve 4 terms. And so if any individuals still have remaining terms available and did not come up this year, they will be coming up next year. And I've been getting in touch with individuals in the spring when they have a term coming up that's ending to see if they want to be reappointed. So if you were not up for reappointment this year, I'll be in touch with you next spring to see if you'd like to be reappointed for an additional term. There was some language that the board discussed concerning the advisory committees at the board meeting. There was a question referred from your advisory committee to the board a recommendation concerning if individuals have served on advisory committees for 4 terms, would there be some flexibility to allow individuals to continue to serve in the future? And so the board discussed that and also discussed the value of having new members come onto the advisory committees as well. And ultimately, what the board decided to do was to modify the advisory committee policy. And so they said, essentially, board advisory committee members can still serve 4 two-year terms on the same advisory committee. And then when they had reached the end of that 4 terms, they would need to come off the advisory committee for at least a gap of 2 years. And then after 2 years, they would be eligible to seek appointment back to the advisory committee if that's something that they were interested in doing. So kind of a balance between making sure that new individuals were continuing to serve on the advisory committee, but would also allow individuals to come back to the advisory committees. And if individuals did serve 4 terms, had a 2-year gap, they would be eligible to come back to the advisory committee and serve an additional 4 terms. So it basically changed the maximum length of service from 8 years to 16 years, but there did need to be at least a 2-year gap in service after the first 4 terms. So that is something that we've updated in the advisory committee policy, and that's something that we'll be following going forward. There was also a board action to appoint an individual to serve on the Kansas Fights Addiction Grant Review Board. In the past, the board had appointed Jason Hess to serve as the board's designee to that entity. And when the board initially appointed Jason Hess to serve as the board's appointee, they had basically said they wanted to revisit that decision in 2 fiscal years. And so we were coming upon the end of that time period. And at the meeting in May, the board formally voted to reappoint Jason Hess to continue to serve as the board's designee and mentioned they would like him to come to a board meeting in the future to share some information about the work of the committee. He's been providing updates, written updates for the board, but he'll be probably visiting either in person or over Zoom to provide more feedback on the work of that group. The only other updates that I would mention to you, we talked last time about certain states requiring jurisprudence examinations, but some of the issues involved with that, in that it would be one more requirement for individuals to meet to become licensed, and some states implement that by outsourcing it, and then the certain entities charge a fee for that to be completed. And as an alternative, we had proposed that perhaps this is something the BSRB could do sort of as a service instead, and offer it as something free for licensees, and maybe even open it up to other individuals like students, and offer it as a more of a webinar, a live jurisprudence optional kind of an examination, and allow individuals to get 1 hour of continuing education for attending those webinars quarterly. And so there was some positive feedback from the advisory committee. We took that to the board, and the board was supportive of moving forward with that as well. So we do plan to try to implement that sometime this fall. We'll be working on some questions for that sometime coming up here in the near future. And then the last item I wanted to make you aware of from that board meeting, for the last several years, the BSRB has been receiving licensing support from the Board of Healing Arts through an agreement, an MOU. We do spend about $72,000 per year on our licensing system, and we receive services through system automation in my licensed office. However, last year there was a bill that passed the legislature that enabled the state to create a enterprise licensing provider, and that was appointed to a company called Acela. And essentially what the state wanted to do was provide an alternative to traditional licensing, and let states state agencies move to that new platform if they were interested in doing so. And so we have been researching that to see if it would make sense for the agency. We knew that the transition would be a fairly high upfront cost to move our information from one system to the next, probably over $200,000. We did receive some information and clarity recently that that cost would be covered by ARPA money, COVID-related pandemic funding. And we also learned information that the legislature did pass a bill that allowed for payment of ongoing costs for individuals switching to that licensing system. So that meant that the payment for not only implementation, but also ongoing costs of using the licensing system would be paid for by the state or through that ARPA money. And so we brought this information to the board. We also talked about the increased functionality of moving to that new system, one item that we've wanted to move towards for the last few years has been the ability for individuals to apply for licensure online, but we have not been able to set that up yet. However, moving to this new system, that will be something that we'll be able to integrate. And also, we have a number of functionalities right now that we have improved our solutions for, but they're not all connected. And so, for example, we have a payment portal on our website, but our staff have to manually connect some of the payments to individuals when they apply for licensure. With this new system, there'll be a way for us to keep track of all of that seamlessly, and also for us to make sure that individuals, when they're applying for licensure, must answer every question. So there'll be fewer technical issues when individuals do apply for licensure. So the board did vote to approve us moving to the new system based on the number of other agencies that are already in the pipeline to move to that system. Probably, I don't think we would see a full transition over for about 2 years, but there will be a lot of work behind the scenes as we begin the process of getting our forms and other information ready for them. And then they'll be starting to implement those things. And we will provide updates to you, but a lot of that will probably be behind the scenes, and we'll just provide updates as we go along. But it should be a nice benefit. And with a savings that we believe of about $72,000 per year, that means that any kind of timeline where we would have to revisit the cost of licensing and look to see if we need to balance any fees, we can prolong that without having to increase fees. And so just a benefit to licensees, we're always trying to look for efficiencies so that we don't have to raise fees on licensees. So with that, I'll go ahead and end my report and see if there's any questions.
Thank you, David. Are there any questions or comments from advisory committee members? Okay, just a note that I want to acknowledge Jardine for bringing up that issue about terms, because I think there was really good discussion that the board had following that. Thank you for that. And board was supportive of making a change in light of that comment. So thank you so much for that. We will move to the old business discussion, and the first item we have is discussion of the educational requirements for licensure.
Yes. So
you or Leslie kicking us back off on that.
Sure. And at the last meeting, you may recall, we talked about the educational requirements for licensure regulation. There should be a copy of that in your packet, 102-5-3. And I did include the version of that went before the board. The board has recommended for the post-hearing change. The additional language is on page 1 in terms of the synchronous or real-time video conferencing, but the other changes you have kind of seen and have been published on our website and the Kansas Register. But at the last meeting, Chris Cabin had volunteered to kind of compare some of the educational requirements in our regulation to what is in the National Accrediting Bodies code. And so unless you have something, Leslie, I might just turn it over to Chris, and then he can kind of share his comments. And Chris, if you wanted to share your screen, you're welcome to do that. Just let me know how you'd like to proceed.
Great. Well, thank you. Can you all see this? I'm fairly visual, so I've created this side-by-side chart in Excel. What I really did is I went to the 12.5 accreditation manual for COA, which I'm getting to be quite familiar with because we have a self-study due this fall ourselves. Accredited programs are required to have foundational curricula that include different areas, some of which have credit assignment associated with them, and a few which are required that somewhere in the curriculum you address those types of things. And I'm not going to go into huge depth about them, but one requirement would be a foundation, 6 credits, really introducing students to the foundation of systemic practice. Really would include the history and systemic philosophy of the field, as well as a biopsychosocial framework that's behind that, maybe more contemporary foundations of MFT that are undergirding the field. And then 6 credits that are related to widely applying treatment approaches. So here I would really think of this as theoretical models as well, but those be applied to a wide range of individuals, couples, and families that can also include training around sex therapy, same-sex couples, children, adolescent. How do we apply these to the elderly, to interfaith couples, as well as making sure all of this has an evidence-based treatment backing to it. 3 credits related to diversity that are addressing diversity, power, privilege, oppression, and how that relates to any number of variables. I didn't list them all, but age, gender, health, SES, sexual orientation, etc. And how to practice, really introducing students how to practice with diverse, international, marginalized, underserved communities, that includes addressing approaches that are aimed at being anti-racist in nature. That there's 3 credits related to research and evaluation. This is less at this level about doing research as much as being an informed consumer of research, and again, an understanding about evidence-based practice. That there are 3 credits related to professional identity, the law, ethics, and social responsibility. So this is primarily related to understanding our code of ethics, as well as understanding legal responsibilities that a clinician would have. One of the things that's relatively new to the curriculum from previous editions is that there's 3 credits addressing the biopsychosocial health development across the lifespan. So introducing the biopsychosocial approach and addressing that as clients and individuals of treatment would move across the family life cycle. Diagnosis and treatment, that there'd be 3 credits related to that. That includes not only assessment and diagnosis of major mental health issues, but also making sure that people are well trained in assessing for addiction, suicide, trauma, abuse, interpersonal violence, how to treat people with acute chronic medical conditions. There'd be relational assessment with that as well, and that constitutes 3 credits. And then there's no credit assigned, but how is the program addressing contemporary issues that can include things like immigration, AI technology, same-sex relationships, violence? Programs are free to be creative with this, and that this would be something that's evolving as issues emerge in the field. What are we doing? Again, no credit assignment, but can the program demonstrate training students around multidisciplinary collaboration, and also an expectation that we are training students regarding telehealth, the legal issues that go along with that, as well as practices of like how do you join in a telehealth setting, how do you respond to crises, etc. So that's the current kind of foundational requirements that are required in the curriculum. As I read 102, 5.3, there's 3 primary areas that are required for people who are applying that do not have COA accreditation. I want to explain my little note here. Technically, you need to have, if I read it correctly, 9 hours total from these 3 areas. So for me to say 3 credits here, I put 3 part of 9, meaning if I understand it correctly, you might have 4 here and 2 here and 3 here. But there needs to be 9 in these areas. So this would include an area around theoretical foundation, which these aren't actually, if you look at 102.5.3, they're not really laid out in this order, but I was trying to do my best to coordinate with how they would fit in comparison with COA. So there is a section on theoretical foundations that also is looking at the historical development of systems theory, cybernetics, family life cycle, and family processes, which to me seems to relate best to this. So this is part of 9 credits. Our COA requires 6 credits in this area, whereas there would be part of 9 here. Another thing that is required from the statute is, or the regulation is, marital family assessment. And this really, if you read through it, it says an understanding of the major theoretical models. It does list out many of our classic models: structural, strategic, intergenerational, contextual, experiential, systemic, and behavioral. There needs to, again, this is part of the 9, which seems to be largely in line with the clinical treatment component of COA, which is really getting at the theoretical approaches. COA is focusing on making sure that you're applying those to a wide range of people. But this is really outlined that you have a theoretical component. And then a human development period that is also making sure that there's an interplay of gender, ethnicity, and an engagement with client's ecosystem. So this can include sexuality, sex functioning, sexual identity, stereotyping, racism. So again, while this may not land completely with a diversity course per se, it has a read like that. So you have to have 9 credits in these 3 areas. And then, whoa, Chris, be careful here.
Wait, Chris,
Yeah,
can I interrupt? You
Yeah.
have to have 9 in each of those 3 categories.
really?
Yes.
Okay. Well, I read that differently.
Yeah, you have to have 9 total credits in each of those 3 areas.
Yeah,
So that is very different.
I couldn't be more embarrassed. I'm glad you clarified that.
Oh,
I'm
no
looking for
problem.
where it said that. Because I thought in another place it said there were 15 credits that needed to be, okay. I'm trying to think while not being overcome with embarrassment while I'm looking for.
No, don't be embarrassed. I look at this every day.
Yeah, but I wanted to see what I was reading because,
So I'm looking at the reg.
okay, it says, I'm looking at, the program requires each MFT student to successfully complete a minimum of 9 graduate credit hours. Oh yeah, in each of the following substantive content areas. I had interpreted that as from those 3. So,
Right.
right, so that's very different. Look at that. All right. So then there's a research course, research credit that's required. 3 credits are required in the area of research, and then 3 credits are required related to an area called development of professional attitude. And it does specify in the language that this is more than just a generic ethics course. There's a lot of language like making sure that there's training around the professional organization, licensure, legal responsibilities as well, which I think is inherent in what the COA standard is getting at as well. And then for anybody that has applied since July 2003, there's a 3-hour course requirement on diagnosis and treatment of mental disorders using the DSM. So that would be 3 credits here. So now when we look at the intern or the clinical requirements, COA recently in the last edition has really lowered the direct client hours expectations from 500 down to 300. 100 of those still must be relational, and whoops, this line should be here. The 100 hours, you also need to have 100 hours of supervision, which can be either dyadic or in group. Nice spelling of group there. You need to have 50 hours of observational data here in supervision. The clinical side for the regulation is there needs to be 300 hours of direct clinical contact hours, 60 hours of supervision, 30 of which needs to be individual. So there's a higher expectation, I think, in terms of supervision relative to the standard here. But that's how it compares. So does that make how am I doing in terms of my explanation aside from being incredibly wrong about one section?
It's really good, but I was just trying to do some math and I was failing on it then with the difference of the 9 hours. So what's the total if we have 9 hours of in each of those areas, did our total number of hours skew?
Well, so you have 27, 30, 33, 36. Twenty-seven, 9 times 3 is 27, 30. Oops, sorry, 33, 36 would be required from the regulation. So that's my effort to offer a comparison for those between COA and the regulation.
I think that the way that the statute language is written, that it sort of collapses some of those categories together, the ones that aren't covered maybe in the bottom there. Because the definitions of each of the requirements is lengthy in terms of all the things it encompasses.
Right.
So I wonder if we capturing, I'm just looking at the language. I think we're capturing the same areas. They're maybe just labeled differently.
Yes, I think that the regulations here really offer, I mean, you want to write it so that it covers part of what you need, but broad enough that different programs can express them as they need to. There are some places where, so for example, this would talk about the family life cycle, where it might be listed in a slightly different area, perhaps even in the psychosocial area here. So I'm not remembering if there was an action that you needed from me, but I know as we were talking about that, I promised to do a comparison, and so there's my effort.
Well, thank you, Chris. I really appreciate you doing that. I think one of the conversations we were having before was um, some of these regulations for the educational requirements for licensure have not been updated in some time, and we're trying to make sure that what the intent of these regulations is that if someone attended a nationally accredited program, we could move them through the process. If someone didn't, do we have some alternate requirements that are substantially equivalent? And if the language in our regulations no longer reflects something that is substantially equivalent to what the national accrediting body would consider, then that's something we might need to take a look at and see if we should change some of the coursework requirements or some of the program level requirements in the regulations. So this is really helpful to kind of see what they require versus what we currently have listed.
Yeah, it's extremely helpful. And I also wondered for Jardine, who has done a lot of these independent reviews, do you find any of those categories that are particularly difficult when you're reviewing applications, or have you seen a lot of obstacles in matching coursework?
I would say honestly, a lot of so I'm only reviewing applications from people who didn't go to accredited programs. So there's that. So sometimes they don't fit into the categories because they don't have to fit into the categories. Um, in terms of like how they do their curriculum. I think probably the biggest hurdle for people is making sure that if they're in a course that is adjacent to MFT as if it's like a counseling program that has an MFT track, does their program provide the theory around MFT? That seems to be people's biggest hangup, is that there's not enough emphasis on um, like the requirements have theoretical foundations in marital and family therapy. They might have it in counseling instead. I think overall it's clear. If anything, the examples could be expanded on, like what is included in theoretical foundations, and maybe pulling some of those items from the COAMP language to help fill in. Like ours includes overview of historical development of systems theory and cybernetics, family life cycle and family process. And then it says it may include adolescent, sexual development, death, and contextual issues. So if we had more examples like listed there, it would be easier maybe to help include people in there. But yeah, overall, it's difficult to say that if it's hard or not hard because their programs aren't accredited, so they're not having to meet those requirements anyway, if that makes sense.
Yeah, I hear what you're saying. Thank you. That.
Mm-hmm.
This is really helpful, I think, looking at these next to each other. So thank you so much for the work in putting this together. Any other questions or comments or thoughts?
There was one thing that struck me, Chris, when you were going through, seems like one of the competencies in the accrediting body did talk about tele services, which I'm sure was not as prevalent the last time that these regulations were updated back in 2011. So that may be something for us to look at, making sure is covered to kind of match that.
Yes, I think there's a stronger emphasis of late on the biopsychosocial approach on telehealth, making absolutely sure that we are training people across a wide range of life experiences. We're very much attending to matters of power and privilege and diversity and those matters I think are kind of key areas. And evidence-based work, that we are training people in evidence-based practices.
Yeah, good point. And a nice observation there, Dave. I think more and more as things change, that's what we need to be looking at, which is really what we were striving to do here, is making sure we weren't leaving something that should be more updated or current. Okay, thank you very much for that. If there's no other conversation around that, we'll move to the discussion on survey of licenses. We started that conversation last meeting with the ability to survey some licenses. Dave, I know you, licensees, Dave, I know you had some information you were going to share with us today.
Yeah, so as we discussed the last time, we have helped out the Social Work Advisory Committee put together a couple of surveys of licensees just in the last few years. I think they've had maybe 3 in total, one as far back as 2015. But since I've been here, there was one that was put out in 2021 and then one earlier this year in 2024. And we have pretty good reports analyzing some of that data on our website. And we did go ahead and get the ability to provide a similar option to each of the advisory committees that they thought it would be helpful to issue a survey to their licensees. And so most of the advisory committees did think that would be helpful and have started the process of considering what types of questions to ask their licensees. And in your packet of material, I did forward a copy of some of the draft questions that the professional counseling profession had put together. I think there are some similarities at times between professional counseling and marriage and family therapy concerning some of the things like the board approved supervisors and some of the other items. And so I went ahead and gave that to you so you could look at it for your review. At this meeting, if we could have more discussion about some other possible questions, the goal I think would be to have maybe about, I don't know, no more than 5 demographic or practice related questions, and then have about maybe 10 substantive questions that would kind of collect information that we could look to identify issues that maybe that would drive some of the work of the advisory committee in the future. But just kind of wanted to get your feedback on some of those questions that the professional counseling profession was looking at, and then see if you had any other questions. I did take some notes from the last meeting. We talked about possible questions, but I think probably if we could take some more feedback today for the next meeting, I could bring back some draft questions for your advisory committee to look at. And then we can tweak those going forward and then ultimately issue a survey to your licensees. So any thoughts on the questions from the professional counseling profession?
Although MFT is way far behind in terms of compacts, I do think it'd be interesting or of interest to have a question around interest in, some type of access MFT or interstate compact, if you will. So even though it's not exactly the same right now, I think looking at the future, it's important to gain the interest of our licensees in that matter. So I think some of those questions might need to be just tweaked a little bit, but I do think it's good to ask a similar question to understand the interest.
I agree. I think for the most part, it represents some great questions, and just like what you said, Mary, just maybe making a couple tweaks.
I think I said this last time, but I think it could be quite interesting because we are relationally trained to know how many people are using that training compared to just seeing individuals.
I've been involved with some work groups recently on the state level that have been looking at addressing issues related to workforce, and some individuals have really talked about the demand for having clinical level practitioners. I know we're a little unique in Kansas in that we have 2 levels of permanent license for both professional counseling and marriage and family therapy, whereas a lot of states only have a permanent level at the clinical level. Professional counselors, they had talked about having a question on here that said, are you pursuing steps to become a clinical practitioner? And if you are not, could you explain why you are not taking those steps? Do you think that'd be something helpful for your profession as well?
As I was reading through these, I was kind of wondering that, because I do think that there are some providers that don't always see the value in having that, especially if they're getting like really minimal oversight. They're checking the box that needs to be done. And so as I was reading that, I was trying to think through how I would ask that question. And so, David, I think how you said that makes a lot of sense, because I think that, I mean, with Medicare changing some things recently, I think that helps. That might motivate people to become clinically licensed. But even with Medicare, I'd have to go back and read, but I think that if you're I think if you've been practicing for 2 years under supervision, I think you might even at that point be able to apply to bill under Medicare, even without a C. I'd need to go read that again, but so I just don't know if there's always a strong motivation for people all the time to get that clinical licensure. So I think that could be a good question. to ask.
Going back to sort of a demographic and maybe a little bit towards Heidi's thoughts on there too, but I think types of setting, it would be of interest. You know, how many MFTs do we have in more agency-based versus private practice? So it'd be nice to see if we could have some versus like a hospital setting or some type of other community setting. It'd be nice to have some questions around that just to really see where the majority of our licensees are working.
You know, we've had some questions recently too in terms of how to quantify workforce, and those conversations are always a bit challenging because what people do with a professional license is often very, very different. And like, for example, I'm a licensed attorney, but I don't do any work on wills and trusts. I don't go to the courthouse and stand in front of a judge. I'm not employed as an attorney for the board, but I keep my license active and I use those skills in my role. And I know that there are some people who hold a license and they maintain it, but they may not be providing direct services as we would normally think about, you know, someone providing therapy or other services. And so, any thoughts on how to quantify something like that?
Yeah, that's a really good point. So I think for me, in addition to sort of practice setting options would be, is this, you know, kind of, is it direct service, direct clinical service to people? And if so, sort of what effort are you putting in? Like, is that a 5 hours a week? Is that 20 hours a week? Kind of getting this sense of what are the roles that people are putting themselves in, and then how much capacity, what are they really serving in that? That's a good point, Dave.
I love to dig into the data and get the numbers, but really try to figure out what those numbers mean too. Because if somebody was saying, well, you're not practicing as an attorney, so you really shouldn't be counted, I would take offense to that because I am an attorney. But then again, if you're trying to say, well, we need this many attorneys to fill this many jobs, if I'm not choosing to work in the legal field, you know, how do we get a grasp of this? And so right now we have sort of an interesting setup because we have a number of individuals living outside of the state that may be providing telehealth into the state, but they have a license here, but they may live in, let's say, Missouri, or other individuals who may travel. And so let's say their official residence is in Florida, but they come to Kansas and provide services here some parts of the year, but they choose to live permanently in Florida, but they're still physically here some of the time providing services. And so how we quantify the demand and meeting the demand is kind of interesting. So I've been having some conversations with some other state agencies like KDAS recently, as far as how do we get a grasp and a better picture of what the need is, and then what we're currently providing without excluding people completely, but also not counting people if their primary role is not in a service type role.
Maybe the question is, are you clinically active? If so, then the follow-up question is, how many hours of therapy do you provide in a week? And then if you're not, maybe it's more of an open forum question of how do you use your license?
Yeah, because I do think it's interesting. We're looking at these professions, but if people are fulfilling other roles, then that is helpful for other professions too. So it's kind of like a big system. But if we can provide more data that sort of looks at this and provides good information that people can use, I think that will be helpful.
Will that have a means then to ask if they're employed in another profession, or is that helpful to know? Maybe they're licensed, but they're teaching high school, or I know of someone who's in pastoral care, licensed as a therapist, but working as a pastor.
Yeah, I can see if there's a couple of options and an answer to that question, like are you working in community mental health, nonprofit work, administrative role, direct clinical work, or other, and having sort of this other open category, or maybe one of the answers is not working in a capacity that uses my license or something like that, just so we can kind of get a sense of those features.
Well, and then you got to make sure you have room for us that are like, I'm a director, I provide direct service, I have a private practice, I teach, all those things. So a lot of people wear multiple hats too. So
I also can imagine if they have a license that they're not using at all, they're probably not also answering BSRB emails.
Yeah, it'll be interesting to see the response rate. We did a survey for the social workers back in 2021, and at the time, I would guess there was probably about 7,500 social workers, and we got responses from over 1,000. So that information was helpful, but this time around, we used some different techniques, and we were able to follow up and target the people who hadn't responded to it yet. And so even though there was about 8,200 social workers, we got responses back from about 2,700 people, so a much higher response rate, and that was pretty good. And so I am curious if that will reflect the same percentages from the other professions, but we'll try to leave it open. We tried to learn from our past experiences doing that, so tried to leave it open a little bit longer and then send out a couple reminders just to the people who hadn't responded yet. Sometimes people list a school email address and then graduate and don't update that, or they work for an employer and they list their employer address and change but don't update that. So we've been trying to kind of make sure we have good information on people too, so that they're not missing important information as well. So but that's a good point. If individuals don't respond back, our data is only going to be as good as the people that respond. So we're going to try to encourage people to help us out so that we can have good information. Well, you gave me several good comments last time, and I do have a list of those items, and I'll take the new information from this. And the professional counselors, they did have kind of some nice catch-all questions at the end of their survey as well, that just kind of said, do you see any issues in the field that you think practitioners could use more education or continuing, training or continuing education on? Or I forget their last question, but it was a pretty good sort of opportunity for them to provide an open-ended answer to us. So I'll try to put together some draft questions for you all. You can take a look at those and then maybe tweak the language the next meeting. And if they look good, maybe we can send out the survey after the August advisory committee meeting.
That sounds good. Thank you, Dave. Okay, moving to new business items. The next item is advisory committee membership. And they've sent a separate email with some files and resumes. And I'm not sure if everyone had an opportunity to review those. We had looked at with 3 members terming off, looking at the opportunity to provide, to add more members to our advisory committee. Dave, I don't know how much background and context you want to give to this from what you shared with me, but go ahead. I'll hand it over to you.
Okay, so we do have an advisory committee policy that outlines the number of members on the advisory committee that are non-board members. And so we basically, the information in there says they're the board member for that profession. If it's represented on the board, will be the chair of the advisory committee. There will be a public board member, and then there will be several non-board members on the advisory committee. And there should be a minimum of 3 and a maximum of 10. And so, Mary, you're right, with 3 individuals reaching their maximum terms of service, that means after July 1st, there would be 4 members of the advisory committee. which would still be above the threshold of the minimum of 3. But in general, most of the advisory committees tend to be on the higher end of that spectrum, probably closer to about, 7 or 8 or even 9 advisory committee members. So we did send, after the last meeting, I sent a message or had staff send a message to all licensees saying that if they wanted to serve on the advisory committee, to submit a letter of interest and a resume or CV, and then that information would be provided to the members of the advisory committee. Unfortunately, we didn't receive any new materials from applicants this time around, and you were not the only advisory committee that occurred with. But we did have quite a few individuals who applied for consideration last year when it was opened up. And so I went back, and after talking with Mary, I went back to that list, and we thought it would be helpful for all of you to just be able to review the information submitted by individuals last year that were still interested in being considered for advisory committee membership. So I reached out to all the people who had applied last time that were not recommended, and asked if they were still interested in being on the advisory committee. I heard back from all but one, and I gave them the opportunity to either allow us to use their materials from last year for your review, or to see if they wanted to provide updated materials, and we had some do both. And so I went ahead and sent those to you, and I apologize for the quick turnaround with that. But I think there were about maybe 5 individuals that I submitted materials to you. And for those of you that were on the advisory committee, this may be the second time that you reviewed material from those individuals. And I think it can be a little challenging when some people apply for advisory committee membership because there's only so many spots. And so sometimes, there's an incredible number of good candidates, but there's only so many spots to fill in the advisory committee. So we wanted to encourage those people who had applied previously and send that to you. So I hope you had a chance to review those materials, and if you feel comfortable, you could have discussions on recommendations for advisory committee members today. So maybe I'll just go ahead and turn it over to you and see if the advisory committee has thoughts on new members.
Does everyone feel like they had adequate time to review the resumes and letters of interest? Okay. So at this point, if someone has a recommendation of someone they'd like to put forth, again, we don't have to add a certain number, but I think it's important that we continue to make sure that we are looking at those staggered terms and how we bring people on. So I would open the floor to recommendations if anyone has some thoughts that popped out of this group.
Mary, I don't have a specific recommendation, but the ability to reapply after 2 years,
Yes.
is that, when did you mention when that starts? I might have missed that.
Well, the board made that decision, and so it's not a regulatory issue or a statutory issue. It was just a practice and policy issue with the board. So my understanding is it's effective immediately. So we can, again, looking at the 3 people here who are terming off, if they took their 2 years out, they would be eligible to reapply.
Yes, and I was just wondering about maybe some who had timed out in the past few years, if they
okay.
if they are aware that they could apply and
I see.
board
Yeah.
again.
Yeah. Great thought there.
Yeah, and I believe, I'll double check this, but we did not send out the message to individuals until after the board meeting because we knew this item was going to be discussed, and I was curious if there would be a change in policy. And so we waited until after the board meeting, and I believe the message that we sent out to individuals to see if they wanted to apply for consideration or not, I think that message did reference the new change in the advisory committee policy that said individuals who previously served could apply for consideration again as long as there was a 2-year gap since their 4th term. So,
Thank you.
Hey, Mary, one of the things I was interested in hearing the members of the advisory committee talk about is whether or not membership on the advisory committee, is it better to have, and I assume it is, but I could be wrong, current practicing members of your profession as opposed to retired members of your profession, or current practicing members of your profession as opposed to people that no longer see patients but are the head of a multi-site organization. I was just curious about that as far as what the group was looking as far as input to this committee.
mean, for my opinion, what makes a strong advisory committee is having a diverse set of skills and people working in different practice locations and different geographic areas, because in all types of settings, we see things differently. And so I think for me, I think the more experience and broad perspectives we have can just strengthen the advisory committee, but we don't, in terms of, that's, you know, that's my opinion, not necessarily set anywhere else.
I think I've asked this before, but I don't remember the answer. How do people within our profession get notified that we've got openings? I mean, I, for one, my email is one that is hard, like my personal one that just gets clogged. So I know I miss things in there, but I didn't know like how, yeah, people within our profession know that there are openings. I can't remember how I knew that there were openings, honestly. And that was that was not that long ago. But yeah, I was just curious how that happens.
So we do send a message from the BSRB email. It's a message from me, but it's sent from our main email address. And it basically gets sent out to the licensees for each profession that have a permanent license. So it would be sent to all the clinical level and LMFTs as well. And it basically just kind of has the advisory committee policy attached to it and just kind of outlines the advisory committee is seeking individuals who are interested in serving on the advisory committee, if they're interested in doing so, to provide a letter of a recommendation or a letter of interest, and then either a resume or a CV. And then it provides some links to some helpful material about the advisory committee. There's a link to the website where they can kind of research what the committee does. And then there's the link to the YouTube as well if they want to go back and watch past meetings. So we always send that message out. In the past, sometimes advisory committee members they might have known of a few people that they thought would be good candidates, and word of mouth also sometimes is what people use. And then ultimately people still need to apply the same way, and then we collect all the information, but usually it's driven by that email that gets sent out.
Awesome. Okay, thank you.
I reviewed the 5 candidates, I guess you could say, right before this. And I haven't been here very long, but since I've been here, what we have talked about is education requirements, applications, lots of stuff like that. And I thought that Betsy Henderson might be helpful because she came from out of state. She had to deal with that system, with getting a Kansas license and dealing with all that. She also, like Mary was saying, she has lots of experience, both doing clinical work and doing kind of like director work and like education work. And I thought, well, seems like could be a helpful voice to have someone that's been through the process.
One thing.
Yeah, thank you. Go ahead. Sorry.
I find myself hesitating my comment. Because I can hear in my head how it sounds. I'm looking at I appreciate that point of view, and I was thinking the same thing regarding having been licensed in in other states would be really helpful. When I look at like education, I feel like I see an identity with professional counseling, and I don't know how much weight to put on that. I sound like a real purist here, but in an environment where we have representation in other disciplines, I guess I get a little curious about where one would see one's identity. That being said, there's licensure as an MFT in 3 different states. Having done my training in California, I also know, well, I mean, so that's my only hesitance.
Mm-hmm. Mm-hmm. Yeah, I think those are great comments and feedback and things that we should be considerate of. As you mentioned too, with this, we are a composite board, and so there's a place and space for all, each of those professional identifications. And so I certainly hear both sides of that.
Now, I know one of these applicants, Diane. I've worked with her in other agencies and stuff like that and other practices. So I think she would be good for this board. But
She's the one that stuck out to me a little bit, just with some diverse experiences, and that would maybe be beneficial for us.
and she, at one point, I believe, worked in Texas and then transferred up here. She's worked in foster care. She's worked in mental health as youth ministers or youth programs. I've just known her personally. I've known her, or I should say professionally, I've known her. So I would recommend her if out of all of them, but they all seem to be decent candidates.
By the way, I didn't mean to stifle Heidi's recommendation. She put something on the table and I didn't mean to shut that down. Or to stop conversation. I don't know if there's a procedure for reviewing each person, but I just want to say, didn't mean to close that gap.
No, certainly understand where your comments were intended. So, okay, we have two sort of proposed recommendations. Is there interest in moving forward in looking at a vote to appoint one or both of these people? Or are we feeling like we're not ready to do that, or what would we need to move forward?
And Chris, I just thought I'd add this too, and maybe I should have mentioned this at the beginning. So the advisory committee policy talks about the discussion on candidates happening during an open meeting. You can either reach a consensus as an advisory committee, or you can take an official vote. The only thing it says you can't do is you can't do like a secret vote. So it all has to be open and being able to be watched. In terms of election criteria, I've seen committees do things different ways. The version that I've seen the most is people just talk about which candidate stood out the most to them, given the factors to be looked at. And the advisory committee policy does talk about some different criteria to keep in mind, including looking at diverse representation, including but not limited to geographic setting, gender, culture, and ethnicity. And that members should provide representation to the levels of licensing for that discipline, and those members should be selected from among public and private practitioners and educators. So lots of things to kind of weigh. When it does talk about geographic setting, in the past, most of that conversation has kind of gone towards making sure that members of the advisory committee are, if possible, distributed around the state to make sure that there is individuals across the state that are on the advisory committee. And right now you have a board member for the profession, a public board member. And so all things equal, for quorum purposes, it is helpful to have an odd number of advisory committee members, but that definitely is a very, very minor concern. If you have more individuals to serve on the advisory committee that you think would be helpful, an even number is definitely okay. It's just that there is a tiebreaker. Having an odd number can be helpful, but don't let that be something that would dissuade you from recommending people to the advisory committee you think would be helpful.
Well, and David, the only so you're talking about including diversity and things like that. The only diversity we can really tell from this is location. So that makes it difficult too.
Yeah, it depends what people choose to put in their letter of interest. Sometimes in terms of some of those factors, there is also they talk about the advisory committee policy does mention levels of license. So, there's two levels of license between the clinical or the non-clinical. And so that can be a factor too to look at. And I did try to highlight that. I went through and did verify that all the individuals who applied for consideration last year and are still interested in being candidates, they do all have an active license and good standing. And so I kind of tried to provide that information to you as well. But you're right. Some of it is just, we're limited on what individuals choose to put forward. So that is a factor.
I am fine with us proceeding to just accept the two people that have already been spoken for. I've read all the applications. I don't have any better opinion than anybody else. I also like the fact that they came back after waiting a year.
That's nice too, yeah. I would be in support of that recommendation as well. So let's open it up for discussion. If there's interest in moving forward with the two candidates who were named, or if there's other thoughts around that, given some of the points of feedback.
And David, if I'm correct, we could also bring this back after, if we move a little bit, we can bring it back again next month so we can stagger some of these terms a little bit. Is that not correct?
Well, so you could bring it back. That is true. And the terms go on 2-year terms, and so basically, if you made recommendations today, these individuals could be appointed by the chair of the board at a board meeting. That's the process that has to be followed, and that could happen at the July board meeting. So their term would essentially start at that first August meeting, and then those individuals would be on 2-year terms based on the fiscal year. It is recommended that terms be staggered, and so for the last few years, we've had advisory committees look at new members about once a year. So that has helped with some of the staggering of terms. But yeah, you could bring it back and discuss it at another meeting, or you can make recommendations today and then consider individuals in the future, kind of like what we did with individuals coming back who had applied last year.
Okay, yeah, that was the point of my question. We can make recommendations today, but then we could always add individuals next month, the month after. Okay, thank you.
True. Yeah, it could be revisited at any point in the future that you'd like to. So.
Yeah, and I would also just reiterate one of the points that Dave made, and it's come up in the past too, is, for example, for the people who are terming off, you might know somebody in your practice setting, geographic location, or someone that you would think would also make a good candidate, and those would be good sort of nominations to make to this as well. So I'm just putting that back out there for everyone to remember. Does this committee feel prepared then to move forward with, there's two candidates who were named today, or are we wanting to look at one of them, or are we looking at pushing it to another meeting?
I'm okay.
I'm sorry, Nicole.
I would be okay with voting. I don't know about everybody else.
I was going to say, I think we could move forward.
Okay, looks like that's probably majority there. So I'm gonna, sounds to me like, I mean, you don't say we don't have to do a vote, David, to make that official like that. It sounds like there is enough interest in moving forward with the two candidates who were named.
Yes, I mean it sounds like that's the consensus right now. Since we don't formally adopt like Robert's Rules of Order, we can reach decisions either by taking a formal vote, or it can be by consensus. And it seems like there is consensus to move forward on recommendations today, and that it sounds like the advisory committee is supportive of recommending Betsy Henderson and also Diana Siebel or Seibel. So if that is the recommendation, it's a little awkward, just because the normal process is, what I would do is take the advisory committee recommendations, I would draft a letter, and I'd provide that to the chair of the board, who has authority to make that decision. But since the chair of this advisory committee is also the chair of the board, it'd be like a letter to yourself. But I'll still process just for the formal process.
Yeah.
So yeah.
Okay, thank you for that. All right, great discussion, everyone. Thank you. I think it's a little bit difficult to do this processing out of candidates sometimes. So I appreciate everyone's work on that. The next item is a discussion of regulation on artificial intelligence. So Dave, I'm going to hand that off to you. I am going to step away for just 1 second. I'll be back in about a minute.
Okay, thanks, Mary. So at the last board meeting, there were 2 items on the agenda for the board meeting that were recommended to be deferred to the advisory committees to start a conversation and discussion on. And the first item was to begin a conversation on ultimately how the board can approach the topic of regulating artificial intelligence. There have been a number of stories in the news recently about people developing things like apps or chatbots that are starting to provide therapy or services. But most of our statutes and regulations is really directed at a person providing services, and our authority tends to be over the individuals that we regulate. There is some information about the unlicensed practice of certain professions, but it gets a little tricky, and it gets kind of tricky too, and we're trying to really quantify what is artificial intelligence and what is our role and how can we protect the public. So there have been some stories in 60 Minutes recently, and it's just kind of come up in terms of, and it's not just Kansas, a number of other states are also wrestling with this too. How do we catch up with technology that has really evolved a lot in the last few years? But there's also a number of associations that are starting to put together a task force on trying to provide direction on this topic too. So the board wanted the advisory committees to start a conversation in terms of how to begin the process of regulation of artificial intelligence. And so I thought I would just kind of turn it over to you and see if you had any thoughts on the topic, or if you had any thoughts on ways in which maybe recommendations could be forwarded to the board to help us with that process too.
Well, I
Is
feel like go
Go
ahead.
ahead.
No, sorry, Nicole, go ahead, please.
I was just curious, is this primarily just in regards to providing therapy or like in documentation of therapy?
I think that's a good question. I think it goes to both. I think that there are items that practitioners are using that they may not even say is artificial intelligence. And I think that there are issues involved with that in terms of things like confidentiality and a greater topic of awareness in terms of, should you be using the tools that you're using, and are you using them responsibly? So part of it really is, what is artificial intelligence? And then part of it too is what is acceptable in terms of usage of artificial intelligence and practice, and are you putting forward the right notices to clients and experimental type usage of artificial intelligence. And so I think there's kind of both of is kind of like, how are you using this, and then whether you're using it in a service related role as well. So, and then also there's also the aspect too of, let's say a practitioner creates something that is now providing services in a sense independently. And then what if someone creates like a chat bot, and then that chat bot provides advice to a person and that person is harmed? How do we tackle that issue?
Sure. Yeah, I was just going to share just a little bit of my experience. We've not implemented this, and I don't know if we ever will, but we had looked at a system called Elios at one point. And it is a system where you'd have to have a camera, and it basically observes your session and it provides recommendations for documentation. It also picks up on any of the EBPs you may be using in that session. And it makes recommendations. So with that, like there are things like a client would have to sign to agree to that because of some of what you're saying, David. And so if a client doesn't agree to it, then we can't use the system to be able, like during that session. And yeah, like we liked it because it would help us maybe fine tune some things with EBPs with our staff. and be able to see outcomes maybe differently. We've not implemented it because there is, I think, so many layers you have to consider to protect your clients and to protect your staff with it. But I think some of those systems are aware of some of that, like they talk about that from the very beginning. But that's just one experience. And we also use a tool that uses AI, but it's not a part of a session with a client. It's just looking at the historical documentation that this provider has done, and it gives ideas of, like, as they're putting things together for a session, like, hey, historically you've used these phrases when you're talking about this practice or this tool, or something like that. So yeah, so that's more of like an experiential perspective on some of that, and those are two kind of different things. But
I just feel like I'm stating the obvious. I'm 6 weeks behind probably with this, but I had a graduate of our program who has a friend who's as an entrepreneur in terms of IT development, and had a meeting about ideas about how to use what companies are already doing of translating recorded sessions into progress notes. And I just worry about making sure that the validity of those are checked on some level. I worry a great deal about confidentiality around those. I suppose on another level, if you have a clinician who is involved in doing professional writing, are they start getting into the authorship kinds of ideas of that, but could be more
Yeah.
vague.
I will say, I will say that first off, I think regulating AI is like regulating feral cats. Like,
Yeah.
good luck to whoever's going to try and take that on. But I have a personal experience, not from therapy, but from the medical world, where my experience was the provider kept telling me, well, we have an algorithm and we plug in the stats and the algorithm tells us what to do. And that I felt like was really harmful in my situation, because life isn't an algorithm, and um, my care was not great because my algorithm said things were going fine when, like, the reality was things were not going fine. And so I think there's a risk of allowing clinicians to dabble in AI, and I see the benefit. I see that it would save time. I see that it would help lighten the load, lessen burnout. But I think it could also take away the personhood, and seeing what we can actually, like, seeing the client for who the client is, rather than just, this is data we're putting into an algorithm or an AI making some assessments. And AI is naturally discriminatory and dangerous for people. And so I think I think it's going to move forward, but I think it, as boards and as regulating, we have to be really wary about letting that become part of this very intimate and vulnerable practice that we all do.
Heidi, I really appreciate your comments. And I think too that we use similar things to AI in many ways for diagnosing. And, there's drop down menus on many of our note taking practices and things. So I'm curious, I guess, when you start regulating, and this is just throwing out there the obvious, that how do you decide this is okay and that is not okay? To me, AI generated therapy or a chat box just could be so harmful. Is that different than saying, okay, the client has these symptoms, so now AI is going to come up with the diagnosis that we use? So I guess it's just like I said, stating the obvious, that there's a lot to consider.
As a public member, I brought this up to David I guess about 8, 10 weeks ago when I first started reading about it and seeing it. And my concern as I read the regulations is that since the app is not licensed, then the app cannot practice in the state of Kansas. I was good with that. But then on the other side, to get to Heidi's point, I spent a lot of years as a risk manager for a large healthcare system in Northeast Kansas, and you can Google what that is. We've used drop down boxes, as Marcy said. We've not, when you use algorithms, an algorithm does not treat anybody. You know, an algorithm is just a list of things based on statistics, and this is what is most likely. But that doesn't take into account the individual patient that's there presenting in front of you and talking to you. And my concept at the time when I talked to physicians was that if you sign it, you're responsible for it. There's no such thing as the algorithm led me the wrong way. This is your practice. This is what you do. This is your profession. And so the drop down boxes get kind of interesting sometimes because it does create more of a structured as opposed to a personal report. But the fact that in Heidi's case, I've seen other cases like that where patients are, I'll use the term not seen. And in medical perspective, from a medical perspective, there are patients that are not seen. And I just hope that the future of behavioral health remains that patients are seen.
I have a different opinion. I think that we have seen the evolution of practice go away from solely relying on patients as like the only point of data. I mean, even if you think about the DSM itself, it is a book of things that we decide people fit into. That's how we give a diagnosis. And when you talk about like people not being seen, I mean, yeah, when you look at a set of symptoms, you might pick a behavior disorder, but maybe the person has trauma. So I can appreciate the hesitation, and I think the point was made that it's going to happen regardless of how we feel about it. And so I guess I wonder about how can the board maybe have regulations that sort of separate the practice by people versus the practice by machines. And maybe that's where the board can speak to what they can regulate and what they can hold somebody or something accountable for is practice done by people versus a practice done by artificial intelligence. I don't know.
Yeah, I think these are really good comments and discussions. And the way I've conceptualized the conversation is really around ethics and informed consent and safeguarding what is coming and what is already here, just like these note taker things, just like these other pieces that are already in our system. I think I shared, one of my coworkers sent me a release of information she got from her therapist about informed consent for this AI that's going to be part of their session. And, you know, that therapist couldn't explain how HIPAA was protected, how the information was safeguarded. And so what's informed consent really? And so I kind of look at it like, yeah, here we are, we're in this environment, we have to move forward, that the profession has to move forward. We will want new tools and access to new and innovative things that can propel our profession forward. I think about that in terms of, things they're doing in pharmacology and diagnostically, there's new things happening all the time. So for me, it's just how do we, if we're here to protect the public, how do we set some basic standards for the profession that says you are responsible for informed consent, or you are responsible for understanding the aspects of a product that you choose in the same way that you're responsible for understanding an intervention that you use, right? So that's sort of how I conceptualize a broad, it has to be broad because we will never keep up with statutory language or regulation that will move as fast as this technology moves. So I think all these opinions and just the comment and dialogue is just really important.
I also, going to the chatbot specifically, I think that they naturally will fail. I think that there will be some benefit. People who are really, really resistant to therapy or have lots of barriers might engage in them. But I personally just don't think they're going to work. I don't think people will get healing from them. And the hope is they don't do harm, but I also just am like, I think people will eventually give up on them and say, no, I want to see a real person. I need real therapy, because I don't think that a robot will actually provide healing mentally. And so I kind of have that, I guess, hope that, yeah, maybe we will not have this be a huge issue with like the downfall of the profession to robots or anything like that.
So I've seen some interesting videos recently. One of the things when we talked about robots and computers that I've wondered about when it comes to people providing therapy is how is a computer going to understand sarcasm? For example, if you start to interact with a computer and they say, "How are you doing today?" and you're like, "Oh, I'm doing great." They're like, "Oh, glad to hear you're doing great." It's like they can't, at least most of the computers would just take it literally and would say, okay, well, this is what the text was, and here's the response. At least if it was plugged in that way. But I have seen some things recently where it appears that some of the computers are understanding sarcasm and using that. And one group of individuals that I'm a little concerned about are maybe younger people, that if they have just something on their phone and it's something that they feel more confident about talking to privately than they would another person, maybe they can start going down that trail of interacting with some of this artificial intelligence. And then I don't know, younger generations tend to adapt more of the technology earlier on. And so I'm curious what kind of role that will play. And I think it might be helpful that if we really dug into some of the artificial intelligence out there and kind of at least for me, I could benefit definitely in kind of learning what tools are out there currently and which ones are on the horizon.
So going back to Mary's point and the tools on the horizon, and for some reason, online psychics keep coming up in my head. People call in at midnight to some online psychic, and that's not legislated or regulated in any way, shape, or form. And so, do we even have the ability to regulate somebody on a chat box and saying, "Hey, I'm in trouble," and so now all of a sudden, this AI generated therapist is communicating with them? I don't know that we can, but I think we can regulate therapists using that as a way to provide therapy. So it's like, okay, well, I've got a wait list of 20 clients. 10 of them now are just going to have AI therapy and until I can get around to them. So I guess we also have to look at what do we actually have jurisdiction over.
Yeah, and Marcy, from a technical standpoint, that's a really good question. I've done a little bit of looking into our statutes and regulations, and our unprofessional conduct regulation. It really is written from the perspective of these are people providing these services. And so under 102-5-12B, it says any of the following acts by either a marriage and family therapy licensee or a marriage and family therapy licensure applicant shall constitute unprofessional conduct. So based on a plain reading of that, um, a chat bot isn't really a applicant or a licensee. So our ability to take any kind of action. Now there are other statutes and regulations that basically talk about the unauthorized practice of certain things, but I believe that language still says something about a person. And I think what you could get into is sort of a legal argument of fruit of the poisonous tree. If you are the person who creates something and then that thing goes on to do something else, are you still accountable for what you created and what they do? But yeah, a literal translation of some of our language right now still references applicants, licensees, and persons, and that would be very difficult for us to probably enforce against technology.
And it's a much bigger problem than just here. Like, it's nationally Congress, you know, they have no idea what to do. The schools, it's again, I think it's like regulating feral cats. Like I don't know how people are expected to do that in these positions because it's just so much bigger.
Well, I appreciate all of your discussion on this today. I think it's a good start to the conversation. What some of the advisory committees have mentioned is that they are aware of maybe a person in their profession who has been, you know, maybe a speaker they've heard at a conference or someone they think is knowledgeable about artificial intelligence as it relates to their profession. If you are familiar of anyone like that that you think might be helpful for them to, you know, speak to the advisory committee about, or speak to the advisory committee, I'd be happy to reach out to them to see, you know, in terms of providing public comment or just doing a short presentation, if that could aid the work of the advisory committee. So if you do know someone like that, please feel free to connect me and I'll do a little research and reach out to them and try to see if that might be something helpful for the advisory committee work.
Thanks, Dave. I appreciate that. We'll move on to the discussion of adding each profession's description to the website. Dave?
Thank you, Mary. So this was another topic that came up at the board meeting that was requested to be referred to the advisory committees for discussion. And this is something that has come up a few times over the years, that the BSRB oversees 7 different professions. And for some of the professions, it may not be intuitive to members of the public exactly what that profession represents or what individuals in that profession do, or the role of those practitioners. And so there have been requests at times for us as the licensing board to provide some basic information on our website, at least, you know, with the mindset of the audience being members of the public. How can we help them by providing just some general information in terms of what the profession is? And so each of the advisory committees is starting a conversation on this topic. We have technical definitions in the statutes and regulations, and I'm sure each of you as a practitioner could explain what you do, but there's certain terms of art that may make sense to you because you've been educated in these areas and you've been trained and you're familiar with some of that, terminology. But for members of the public, I think it'd be helpful if we added something to our website. We do have a page on our website for each of the professions. We have some information there as frequently asked questions, but most of that information is directed at applicants and licensees to help clarify some of the different items when they apply for licensure. And so that was the thought process, is that the advisory committees could start a conversation on this. Ultimately, we could find some good working language that we could add to our website as a general description of each of the professions. So this could be a conversation we start today, but if there's not thoughts immediately today, I just wanted to frame this and ask if the members of the advisory committee could start to think about language that we could work on as a group, and then ultimately refer back to the board, and then the board could, adopt. It's not something that would go into the statute or regulation. It's more about something we could add to our website, sort of as a service to the public to help them understand the professions a bit better.
Yeah, thank you, Dave. I think it's we'll bring that back at the next meeting. So just kind of put that in your mind, as we've had feedback off and on. I'm sure you all have received feedback of people not understanding the differences among professions or between professions. So this is kind of an opportunity for us to talk about what's different in each of those. So we'll bring that back to the next meeting. The next item we have are discussion topics for 2024. We've said this before. Certainly, if you have suggested ideas, please bring those forward. But if there's any thoughts that are top of mind right now, we would certainly take those as discussion points as we build the agenda for this year. And just remember, if something comes up in between meetings, please don't hesitate to send a note to Dave or myself so that we can make sure to incorporate those ideas into future meetings. All right, the next item of business is recognition of the advisory committee members who are terming off, unfortunately for us, Jardine Coleman, John Fleeker, and James Godby. Dave, I didn't know if you wanted to start any conversation on that, or I'll certainly take it on.
Why don't you go ahead, Mary?
Okay. Just certainly an acknowledgement of the work that's done. You know, it's been really exciting for me to watch the evolution of the advisory committee over the last several years and how much work has actually been done. And Jardine, I've probably known you the longest of the group and know how much specific work you've done outside of the advisory committee meetings. So I just personally want to thank you for investing time in things like board approved supervision, the manual work, just bringing expertise like that. I certainly appreciate your opinions and feedback. And again, appreciate your thoughts around taking terms off and being able to come back, because there's a lot of value in doing that. John and James, you guys have contributed such great thoughts and opinions to the work here. We're certainly grateful for all of the time that you spent with us in this committee. I'm just grateful for everyone's hours and time and service. You know, John, you brought certainly diverse practice settings and thoughts to this group, and they're all appreciated. And Jim, as we've been able to talk a little bit more and through your moves through Western Kansas and back to here and those kind of things, I know you've also brought some great thoughts to this advisory committee too. So I just want to thank you all. It is a dedication of time and service, and just appreciate your work for the committee.
Right, and on behalf of the BSRB, 100% agree with what Mary said. Appreciate all the time that each of you has volunteered. Your comments have really benefited the work of the advisory committee, and it's led to a lot of really good board actions as well, helping members of the public and also licensees. So really appreciate your time. And you know, after a 2-year gap, if you're interested in applying for reconsideration, please keep that in mind. But definitely want to thank all of you. And we will send each of you a certificate in appreciation of your work on the advisory committee. So I just want to say thank you again to all of you.
Very much so.
You're very welcome. It's been a pleasure to serve. And I'm glad I can say see you later and not bye.
Well, I want to say that it's been a learning experience for me and a great time to learn more about the profession. As you talk about today, coming from with two different worlds that I'm serving. So I appreciate hearing the counseling side, and that it's been real good to be about this as far as the policies that you make.
Yeah, as I just seen the evolution of the practice of marriage and family therapy. You know, I've been in this state back into this state for a while. I've even been on BSRBs in other states. It's just it's good to see that Kansas is progressing and keeping, you know, diversity and that being on top of everybody's minds as well. So I appreciate and thank you for all the support you guys have all had.
Well, thank you very much for that. Again, appreciate your service, and I know everyone on this committee does. The last item we have is a discussion of the August meeting date. Normally, it would fall, I think, on the 9th would be the meeting in August. I have a conflict with that date, so I wanted to check in and see if there was another Friday in August that would work for the committee members here. And if I remember right, Chris, that can get plugged up in the MFT programs in August. So just wanting to put that out there in terms of what dates would work for our next meeting. And if we don't have that, we can always do a doodle poll, but I thought if we could come to consensus here, that would be helpful. Does anyone see that August 2nd or August 16th as alternative dates? I know David Fye already checked conflicts with the BSRB calendar and they looked good.
The 2nd actually will be a conflict.
Okay.
And the 16th would be open if we did it in the afternoon
Okay.
at 1 o'clock. There's no issue with anything on the 23rd or on the 30th. So 23rd and 30th are wide open, and the 16th at 1 o'clock. Either of those would be fine.
16 would work for me.
Yeah, 16 would work for me as well.
So that's the afternoon, is that correct, Dave? Is that what you said?
Yeah, so something like 1 o'clock to 3 o'clock.
Okay.
I would do better with the 30th in the morning, but I could make the 16th work if nobody can make that happen.
The 30th, let's see, will that be, that'll run into Labor Day weekend.
It will. Mhm.
And that might be problematic. The 16th would work for me. Does it have to be on a Friday?
It doesn't. That's usually been our meeting time. So it does sound to me like the majority of people could make the 16th work. Can you, Marcy?
Yes, I can.
Okay. Jim? Mark?
Yeah, look, the retired guy's got the busiest calendar, so the 16th is actually I'm out of the country most of August, but I can make the 16th work.
Okay.
I'm
Poor
glad we had to do the
Jim, out of the
16th
country again.
I know. I get
All
back from
feeling so
Ireland.
bad for you.
I get home from Ireland on the 9th, and I go back to Alaska then on the 21st. So,
Boo-hoo. Okay, it sounds to me like let's look at the 16th from 1 to 3. Thank you for getting through that. Sometimes scheduling is the hardest part of what we do.
and I assume, David, you'll just move the appointment.
Yes, I'll switch that appointment from the
Okay.
9th to the 16th. I think it was already sent out, so
Yeah.
that will just change, and I'll just send you an email to let you know. But the Zoom information should stay the same for you.
Okay, thanks.
Okay, great. If there's no other business, then I think we will motion to adjourn this meeting.
I so move.
Second.
All right, everyone, thank you so much for your time. To those members coming off, thank you for your service. We appreciate you, and everybody have a great summer till we see you next.
Thank you.
Bye,
Thank
everybody.
you.
Yeah.
Bye.
Bye.
Bye.